Okay, so we're going to assess dorsiflexion of the ankle in weight bearing and non-weight bearing. Dorsiflexion of the ankle is important for push-off of gait, so go ahead and bring your foot back. And so when you're in that phase of gait, in the Portland test or any kind of load transfer, we need dorsiflexion here and then also advance your foot. We also need adequate dorsiflexion in order to clear the foot. If you can't, your brain knows you're going to trip and then you'll end up hiking, and that's where you get the QL and over psoas activation. In the push-off position, it's basically winding up the whole lower quadrant like a slingshot. So that's potential energy going to kinetic energy. And if the body senses that it can't slingshot effectively, either it doesn't have enough hip extension or it doesn't have enough dorsiflexion in the foot, then it's going to have to compensate to advance the foot, and usually that's through QL and psoas to advance, and there's a loss of efficiency. So dorsiflexion is important. It's part of the clinical practice guidelines for plantar fasciitis, lack of dorsiflexion. It's also part of the clinical practice guidelines for Achilles tendinopathy. So really important to look at. So in weight bearing, we had already discussed this yesterday, but go ahead and face here. Face the camera, perfect. So in a squat position, you're looking for that creasing and you're looking to see if the patient can have some dorsiflexion there, and you have them shift over to the right and then bend the knee a little bit more, see where the dorsiflexion is, and then shift over to the left and bend the knee, and you can feel a slight difference. So in which way feels stiffer to you? You're going to go with left. Okay. So go ahead and have a seat. So that's in weight bearing, and with his body type, you see he has a little bit higher arch feet, so he doesn't have as much flexibility as someone who has a little bit more pronation in it.